So kahit group 4 lang ngayon, then mamayang hapon group 5. Pero kung kaya matapos ng group 4 and group 5, hindi na tayo mag-meet mamayang hapon. 'Di ba? So nasa inyo yan. Depende kung gaano kahaba yung explanation nyo. Okay, so group 4, you may now start. Wala na. Sige, Clyde, start mo na.
Good morning, sir. Good morning, classmates. I hope you are doing well today because we will be discussing to you about infectious or communicable diseases. By the way, I am Clyde Romualdo and I will be tackling about malaria. Please go back. I am not finished yet. And I will be discussing malaria, and my friends or my group mates will be discussing the rest of the topic. So, do you have any idea what is communicable diseases? If you do not have
Yes.
any, okay, Vicente, what is communicable diseases?
Yung yung example po yung sa sipon or ang pinaka ano ngayon is the COVID-19
Yes, you're
infectious.
right.
Yes.
It
Yes,
an
thank you.
example of communicable diseases. So, ang communicable diseases is sakit na nagkakaroon tayo by person to person. Kunyari, if I am talking to you and lagi kitang kinakausap minuto-minuto and I have a flu or uh, ubo ako ng ubo sa harap mo, tapos bigla ka na lang magtataka, may ubo ka na kinabukasan. It is an example of communicable diseases kasi nga, it is passed from person to person. Nagets ba?
Opo.
Katulad na lang yung human to dog. Possible siyang nakakahawa. Kasi nga, kung yung ikaw na may sipon is lagi mo siyang hinahag, lagi mong hinahag yung aso mo kasi nga dog lover ka or yung cat mo, nagkakaroon ng possibility na yung ubo mo or yung sakit mo na nakakahawa is mahahawaan din yung dog mo. That is possible. Okay, next slide po. So, I will be read to you about my objectives. And this is who gets malaria? How is malaria spread? What are the symptoms of malaria? How soon do symptoms occur? When and for how long a person able to spread malaria? And what is the treatment for malaria? Next, please. So, malaria. Let me read to you about what is the meaning of malaria. Malaria is a mosquito-borne disease caused by any one of 4 different blood parasites called Plasmodium. The disease is transmitted to people by the Anopheles mosquito. This disease is a leading cause of debilitating illness, with over 200 million cases each year from around the world. Almost all of the cases reported in New York State each year are acquired in foreign countries. However, a few locally acquired cases have occurred on Long Island and in Queens. So classmates, what is your idea kung naririnig niyo yung malaria? Ano yung first impression niyo kapag naririnig niyo yung malaria?
Mosquitoes. Caused by mosquitoes.
Yes, you're right. Actually, to be honest, ako, kapag naririnig ko yung malaria, akala ko cancer. Which is, I am wrong pala. Or kaya naman yung kapag malaria sila ng malaria. Oy, may malaria si ganito, may malaria yung friend mo. Akala ko yung malaria is yung very pale na skin or yung sobrang yellow ng itsura niya. Wrong pala ako because my topic is about malaria and ito pala yun na ang malaria is caused by parasites na tinatawag na Plasmodium. Nagets? So, kapag tinanong ko kayo kung ano yung malaria, ito yung sakit na dahilan ay parasites na tinatawag na plasmodia. Next slide po. So, sino nga ba yung mga nagkakaroon ng malaria? Any person residing in or traveling to a country where malaria is prevalent is at risk for contracting the disease. Malaria is currently a problem in tropical or subtropical areas of Asia, Africa, and Central and South America. Most Black Africans show a natural resistance to some species of malaria. Otherwise, susceptibility to malaria is universal. So, ang malaria daw is possible to any person. Possible siya sa'yo, possible sa kapatid mo, sa nanay mo, sa lola mo, sa lolo mo, sa papa mo, or kahit sinong kakilala mo, possible na nagkakaroon ng malaria. Kasi nga, nandito tayo sa Pilipinas. Nasa mainit tayo na maraming nahahanap na lamok. And ang lamok is nagko-cause siya ng malaria. And I am not telling na lahat ng lamok is possible na kapag kinagat ka, may malaria ka na. No, wrong. Nagkakaroon lang sila if a female mosquito. Kasi ang Anopheles mosquito daw is a female mosquito. Na nagugutom na kinakain ka na, ganon. Kaya nagkakaroon ka. Pero, I'm telling you na hindi lahat ng lamok. So, next slide po. How is malaria spread? Malaria is spread by the bite of an infected Anopheles mosquito. With certain malaria species, dormant forms can be produced which may cause relapses of malaria months to years later. Malaria may also be transmitted by transfusion of blood from infected people or by the use of contaminated needles or syringes. So as I have mentioned lately or kanina, ang malaria daw na is-spread dahil sa mga female mosquitoes kasi yung kagat nila is may infection. And possible din na nag-i-spread ito kapag in-inject sa'yo yung nagamit ng injection, di ba? Kadiri naman yun na i-inject ng may infection na nga i-inject pa ulit sa'yo. Ganon ang possibility na nahahawa tayo ng malaria. Next po. So, ano nga ba yung mga symptoms ng malaria? Ito yung mga symptoms. Chills, fever, sweats, headache, vomiting, nausea. And as you can see, similar sila sa dengue. Naranasan nyo na bang magka-dengue? Well, ako po, naranasan ko ng magka-dengue. Naranasan ko din na pong ma-hospital dahil sa dengue. And muntik na din po akong matigok dahil sa dengue. And I may say na possible ay na similar sila ng symptoms. But hindi po sila magkapareho. Malaria and dengue is not as one. Similar lang po sila pero hindi sila same. Kasi po, ang malaria is a disease caused by an infection by a parasite. Tapos po yung dengue is a viral infection na kahit anong mosquito pwede. While yung malaria naman is female Anopheles mosquitoes. Kasi nga, nakadepende sila sa blood natin para magkaroon sila ng egg production. In some instances, may progress to jaundice, blood coagulation defects, shock, kidney or liver failure, central nervous system, disorders and coma. Malaria may cause anemia and jaundice, yellow coloring of the skin and eyes because of the loss of red blood cells. Cycles of chills, fever, and sweating occurring every 1, 2, or 3 days is a good indicator of malaria. Which is naranasan ko din to sa dengue. Kaya, para ma-identify natin yung malaria is malaman natin kung kinagat ba siya ng female mosquitoes. And as I have mentioned dito, na malalaman natin kapag anemia sila or may yung eyes nila is masyado ng halata, parang lumalabas na ganon, or very pale na sila na hindi na, ito yung sakit na malala na yung malaria nila. Siyempre, pati naman flu, nagkakaroon ng fever, nagkakaroon din tayo ng chills. Pero hindi natin agad malalaman kung ano yon. Kaya malalaman natin siya if on-off yung fever natin. Kunyari, ang taas ng lagnat natin ngayon. Tapos after 2 days or 3 days, biglang bababa. Tapos tataas na naman. Ganon ang indicator of malaria. So, that is all about my topic, and my group mates be tackling to you about how soon do symptoms occur. Jobeline, I will pass to you my topic. Thank
Ate
you.
Clyde, Ate
Yes.
Clyde,
Yes.
I just want to know with regards to your symptoms. I just want to know if diarrhea may also occur in sa
Yes.
malaria kasi I was once a intern at the hospital and may patient kami na may malaria and nagda-diarrhea siya. It is possible that diarrhea may also occur in yung mga symptoms ng
Yes, it is possible.
malaria.
Yes po, possible po ang diarrhea. Lalo na yung pagburi. Ano Tagalog ng buris? Basta yung masyadong mater yung pagkatain niya, possible din po yun kasi also dengue is like that, na yung tiyan natin is masakit. Kaya I may say na possible siya.
Okay,
Did I-
thank you po.
Okay?
Yes.
Okay, thank you. Joveline, it's now your turn.
Paging Jovelyn? Wala siya? Nandito siya. Miss Pasqua. Turn mo na daw. Moment mo na.
Rinig po ba? Nawawalan
Yes.
po kasi ng internet.
Audible, audible.
So, how do symptoms occur? The time between the infective mosquito bite and the development of malaria symptoms can range from 12 to 30 days, depending on the type of plasmodium involved. One strain of Plasmodium called P. vivax. The P. vivax or Plasmodium vivax, this is the one species of malaria parasites na typically na nag-infect sa humans. It is a protozoal parasite na nagsasanhi ng pagkakaroon ng sakit ang isang tao, and may have a prolonged incubation period of 8 to 10 months. This incubation period is yung time between sa kagat ng lamok tsaka yung simulan ng sintomas. When infection occurs by blood transfusion, the incubation period depends on the number of parasites transferred but is usual less than 2 months. Yung symptoms ng Plasmodium vivax is hindi agad-agad makikita sa blood transfusion. sa kadahilanang ito ay nakadepende sa parasite na nag-infect sa Meron na po ba? Nawala po yata ako.
Yes, nawala ka kanina. Ulitin mo na lang dun sa may part na nawala ka kanina.
Isang part po yung ulit na lang po. How soon do symptoms occur? The time between the infective mosquito bite and the development of malaria symptoms can range from 12 to 30 days depending on the type of plasmodia involved. One strain of plasmodia called P. vivax may have a prolonged incubation period of 8 to 10 months. The Plasmodium vivax, this is the isang species ng malaria parasite na typically na nag-infect sa humans. And ito rin is isang protozoal parasite nagsasanhi ng pagkakaroon ng sakit na isang tao. And yung incubation naman na sinasabi is yung time between sa mosquito bite tsaka yung simula ng simptomas. When infection occurs by blood transfusion, the incubation period depends on the number of parasites transferred but is usual less than 2 months. Yung symptoms ng Plasmodium vivax is hindi agad-agad makikita sa transfusion sa kadalang ito ay nakadepende sa parasite na na-infect sa isang tao. Pero hindi naman ito tumatagal ng 2 months. And meron ding ibang transmission which is yung sharing needles or syringe. Gaya nung sabi ni Clyde po kanina. And next slide po. When and for how long is a person able to spread malaria? Untreated or inadequately treated cases may be a source of mosquito infection for 1 to 3 years, depending on the strain of Plasmodium. Direct person-to-person transmission does not occur. Stored blood products can remain ineffective for 16 days. So, without proper treatment sa mga symptoms ng malaria like chills, fever, headache, vomiting, or yung nuensa, pwede itong bumalik na kusama itong pagmula ng infection ng lamok sa loob ng 1 hanggang 3 taon. And in addition, kapag hinayaan mo itong hindi nagamot ang malaria, pwede itong mag-cause ng anemia and jaundice. Ito yung yellow coloring of the skin and eyes dahil sa loss of red blood cells. At ito ay magiging severe and magkakos ng failure sa ating kidney and also seizures, mental confusion, coma, and pwede rin tayong mamatay. What is the treatment for malaria? Due to the changing pattern of drug-resistant strains, current recommendations can be obtained from your local, country, or state health department. What can be done to prevent the spread of malaria? Since malaria is not native to the United States, exposure to American citizens occurs most frequently during foreign travel to malarious areas. It is very important to contact health officials to determine the proper preventive drug therapy. The liberal and frequent use of mosquito repellents, as well as using a bed net, can be very effective in preventing mosquito bites. So, yung malaria is dangerous and fatal kapag hindi ito nagamot. Treating early reduces yung chance ng complications. Kaya habang maaga pa, see your doctor kapag alam mong meron kang nararamdamang symptoms ng malaria. So, wag mo itong ipagsawalang bahala kahit na ito ay simpleng lagnat lang dahil ito ay isang sintomas ng malaria. Gaya nga ng sabi dito, gumamit ng mosquito net or mag-spray ng mosquito repellent para makaiwas sa kagat ng lamok. And next slide po. Next topic is yung pertussis. So, who gets pertussis? How is pertussis spread? Symptoms of pertussis. How soon after infection do symptoms appear? When and for how long is a person able to spread pertussis? What are the complications associated with pertussis? And what is the treatment for pertussis? What is the vaccine for pertussis for infants and children and also for adults? What can be done to prevent the spread of pertussis? Does past infection with pertussis make a person immune? What is parapertussis? Next slide po. Pertussis. Pertussis or whooping cough is a highly contagious bacterial infection that causes an uncontrollable violent cough lasting several weeks or even months. Pertussis is most dangerous in Pertussis is a respiratory illness and whooping cough which often makes it hard to breathe and also is a serious lung infection. It is caused by bacterium that is found in the mouth, nose, and throat of an infected person. This bacterium called the Bordetella pertussis. Bacteria ito na naka-attach sa cilia which is the tiny hair-like extension that line part ng ating upper respiratory system. Pertussis may begin with cold-like symptoms or a dry cough that progress episode of severe coughing. Next slide po. Who gets pertussis? Pertussis can occur at any age. Children who are too young to be fully vaccinated and those who have not yet completed the primary fully vaccination series are at highest risk for severe illness. Since the 1980s, the number of reported pertussis cases has gradually increased in the United States. In 2005, over 25,000 cases of pertussis were reported in the United States, the highest number reported cases since 1959. Approximately 60% of the cases were in adolescents and adults and may be result of decreasing immunity in this population. So yung pertussis is dangerous sa age, mababata man o matanda. Especially sa mga younger than 6 months dahil hindi sila protected ng immunization. And para sa 11 to 18 years old naman, kung saan yung kanilang immunity is bumababa. Yun lang po. And next one po is
Morning, sir.
Bon.
Good morning, classmates. How is pertussis spread? Pertussis is primarily spread from person to person by direct contact with mucus or droplets from the nose and throat of infected individuals. Frequently, older siblings who may be harboring the bacteria in their nose and throat can bring the disease home and infect an infant in the household. So guys, ang pertussis rin ay airborne. For example, bumahing yung infected person, then yung droplets ng bahing niya nalanghap mo, yun, magkakaroon ka ng pertussis. Isa pa is kapag yung pinangsinghan ng matanda na infected sa panyo, tas yung anak niya hinawakan o ginamit rin nung bata, sa bata na rin yung virus. Indirect yun. Pag direct naman, pag suminga yung matanda, tas pinahid niya sa kanyang anak, yun rin, magkaka-virus rin. Next po. What are the symptoms of pertussis? Pertussis begins as a mild upper respiratory infection. Initially, symptoms resemble those of a common cold, including sneezing, runny nose, low-grade fever, and a mild cough. Within 2 weeks. Within 2 weeks, the cough becomes more severe and is characterized by episodes of numerous rapid coughs followed by a crowing or high-pitched whoop. A thick, clear mucus may be discharged from the nose. These episodes may recur for 1 to 2 months and one more frequent at night. Older people or partially immunized children generally have milder symptoms. Guys, yung symptoms are cold sa mga may sipon, sa pagbabahing, sa may fever, at pag-ubo. Ang sabi dito, high-pitch whoop. Paano nga ba ito nabubuo? Halimbawa, may pertussis ka, tas napabayaan mo. Siyempre, mapupuno ng mucus ang ilong at throat mo. So, kapag maraming mucus, konti lang ang airflow sa ilong or sa throat. Kapag maraming mucus, konti lang ang airflow o daluyan ng hangin. Tapos pipilitin mo namang huminga, tapos pag ubo mo, ayun, mag high pitch whoop dahil sa konti nga lang yung daluyan. How soon after infection do symptoms appear? The incubation period is usually 7 to 10 days with a range of 4 to 21 days and rarely maybe as long as 42 days. So, for example, pag infected ka na, mag-stay muna for 7 to 10 days sa katawan mo yung virus bago lumitaw ang mga symptoms. Next po. When and for how long is a person able to spread pertussis? If untreated, a person can transmit pertussis from onset of symptoms to 3 weeks after the onset of coughing episodes. The period of communicability is reduced to 5 days after treatment with antibiotics. If untreated daw, makakahawa na ito kapag patuloy ang pag-ubo ng infected na tao. Pero kapag nagte-take naman na siya ng gamot gaya ng antibiotics, marereduce po yung chance na makahawa. Next po. What are the complications associated with pertussis? Major complications of pertussis are more common among infants and young children and may include pneumonia, middle ear infection, losing of appetite, sleep disturbance, syncope or temporary loss of consciousness, dehydration, seizures, encephalopathy, a disorder of the brain, and apneic episodes or brief delay in breathing and death. Kadalasan daw ay sa mga kabataan. Kaya kung nagsususpect ka na infected ka na, kailangan mo nang mag-take ng antibiotics dahil hindi lang siya simpleng sakit. Hindi lang siya simpleng sakit, nakakamatay rin ito. Next po. What is the treatment for pertussis? The recommended antibiotics for the treatment and post-exposure prevention of pertussis include azithromycin or Zithromax, erythromycin, and clarithromycin or Biaxin. Alternately, trimethoprim, sulfamethoxazole, or Bactrim or Bactrim can be used. Guys, tong mga nabanggit na gamot ay antibiotics rin. Kaya, yun lang po. Next presenter po.
So, Sir Audible, what is the
Yes.
vaccine for pertussis? Ano nga ba ang vaccine sa sakit na ito? Next slide. The childhood vaccine for pertussis is usually given in combination with diphtheria and tetanus. Immunization authorities recommended that DTaP or diphtheria tetanus a cellular pertussis vaccine will be given at 2, 4, and 6 and 15 to 18 months of age and between 4 and 6 years of age. Noong 2005, isang bagong bakuna ang inaprubahan bilang isang solong booster vaccinator para sa mga kabataan at matatanda na tinatawag na Tdap or tetanus diphtheria, ay cellular pertussis. Next slide. The preferred age for routine vaccination with Tdap is 11 or against tetanus diphtheria and pertussis if they have completed adolescence. Age 11 through 18 should receive a single dose of Tdap instead of TD or tetanus diphtheria for booster immunization. Recommended childhood DTP DTaP vaccination series. Next, for adults. No? Para sa mga nasa hustong gulang na 19 hanggang 64 taong gulang at hindi pa nakakatanggap dati ng doses ng Tdap, dapat palitan ng isang dosis ng Tdap ang isang solong dosis ng TD. Para sa booster immunization, kung ang pinakahuling bakunang may tetanus toxoid ay natanggap na hindi bababa sa 10 taon. Ang mga nasa hustong gulang na malapit na makipag-ugnayan sa isang sanggol na wala pang 12 buwang gulang na hindi pa nakakatanggap ng Tdap ay dapat tumanggap ng isang dosis ng Tdap. Next slide. Healthcare personnel in hospitals, ambulatory care settings. Mga frontliners or direct patient contact who have not previously received Tdap should receive a dose of Tdap. An interval as short as 2 years since the most recent TD is recommended. In New York State, pertussis vaccine is required of all children born after 1/1/2005 who will be enrolled in pre-kindergarten programs and schools. Tdap vaccine is required for children born on or after 1/1/1994 and enrolling in 6th grade. Next. What can be done to prevent the spread of pertussis? The single most effective control measure is maintaining the highest possibility level of immunization in the community. So, paano nga ba natin ma-maintain ang immunization sa community? Stay away from young children and infants until properly treated appropriate antibiotics such as Zithromax will shorten the person can spread pertussis to 5 days after the beginning treatment of people who are contacts of pertussis cases is treatment. People who have or may have pertussis should also important part of prevention. So what is Zithromax or azithromycin? Zithromax, also known as Z-Pak, is an antibiotic used to treat bacterial infections by inhibiting the growth of bacteria in the body. A Z-Pak is typically taken over a 5-day course to treat infections such as bronchitis, pneumonia, and infections of the ear, lungs, and other organs. No? So, people who have or may have pertussis should also important part of prevention. Yung may nag yung nadapuan na ng sakit nito ay importante para ma-prevent yung pagkalat ng pertussis. Does past infection with pertussis make a person immune? Pag nadapuan ka na ba, immune ka na, di ka na pwedeng magkasakit nito ulit. Neither vaccination nor natural infection with pertussis guarantees lifelong protective immunity against pertussis, since immunity decreases after 5 to 10 years from the last pertussis vaccine dose. Older children, adolescents, and adults are at risk of becoming infected with pertussis and need vaccination. No? So, pwede ka pa rin nitong magkasakit kasi bumababa daw ang immunity 5 to 10 years from the last pertussis vaccine dose. So, madadapuan ka pa rin. Next reporter.
Rinig po ba?
Opo, opo.
Yes.
Next po is yung parapertussis. So what is parapertussis? Parapertussis is a bacterial illness that is similar to pertussis or the whooping cough, but is not as common and generally causes less severe symptoms. Up to 70% of all cases of parapertussis will present with no symptoms. Very young infants or less than 6 months of age may have a more severe course of parapertussis than older persons. Parapertussis is spread through the air in drop produced during coughing and sneezing. A person can be infected with parapertussis and pertussis at the same time. Parapertussis can be distinguished from pertussis by certain laboratory tests. Antibiotic treatment should be started as soon as parapertussis is suspected. All infants less than 6 months of age should receive antibiotics as a preventive measure of if they have been in contact with a person who has parapertussis. Although similar po sila ni pertussis na cough and airborne disease, ang difference po nila is mas less ang health complications ng parapertussis kesa sa pertussis. And ang dahilan kung bakit mas severe yung cause ng parapertussis sa mga bata or young infants is because mas mababa po yung immune system nila compared sa mga matatanda. Next po is the pneumococcal disease. In here, we will get to tackle about who gets pneumococcal disease, how is the disease transmitted, what are the symptoms, how soon after exposure those symptoms occur, complications associated with the disease, does past infection with pneumococcal disease make a person immune, is there a vaccine to prevent infection, and how to prevent the spread of the disease. So let's define first what is pneumococcal disease. In here, it includes pneumonia, meningitis, and bacteremia. So pneumococcal disease is a bacterial infection caused by the bacteria Streptococcus pneumoniae, also called the pneumococcus. It may cause middle ear infection, pneumonia or a serious lung disease, meningitis or the inflammation of the coverings of the brain and the spinal column, or the bacteremia or the bloodstream infection. Next, who gets pneumococcal disease? Although anyone can get pneumococcal disease, it occurs more frequently in infants, young children, African Americans, some Native American populations, the elderly, or in people with serious underlying medical conditions such as chronic lung, heart, or kidney disease. Others at risk include alcoholics, diabetics, people with weakened immune systems, and those without a spleen. Infection occur anytime but most often during the winter and early spring when respiratory illnesses are more common. So the impact of this disease depends on the health of the person infected. It can be mild or it can result to serious health complications. So according to my research, there are two types of pneumococcal disease, the invasive and the non-invasive pneumococcal. So yung difference po ng non-invasive at invasive is sa non-invasive po, the disease occur outside the major organ or the blood, while the invasive naman po is it occurs inside or in a person's blood, which is more serious than the non-invasive type, or worse, it can lead to death. Data suggests pneumococcal conjugate vaccine, or the PCV7, has reduced use invasive disease among children and their adolescent and adult household and close contacts. There are vaccines for pneumococcal disease which will be explained later on. Next po is, how is the disease transmitted? Pneumococcus is spread by airborne or direct exposure to respiratory droplets from a person who is infected or carrying the bacteria. So a person can be infected when an infected individual coughs, sneezes, or kisses an uninfected person. So many people get infected by the bacteria through their nose and throat, possibly because it is also an airborne bacteria. Next is, how soon after exposure do symptoms occur? The incubation period may vary, but it is generally 1 to 3 days only. Next, what are the symptoms of the pneumococcal disease? Symptoms generally include an abrupt onset of fever and shakings or chills. Other symptoms may include headache, cough, chest pain, disorientation, shortness of breath, weakness, and occasionally a stiff neck. So disorientation po is losing our sense of direction or being confused anytime. Then, past infection with pneumococcal disease. Does past infection with pneumococcal disease make a person immune? Past infection with pneumococcus does not provide lifelong immunity against pneumococcal disease, recurring due to the many types of pneumococcal bacteria. Next po, Heini. Next presenter po.
Rinig po ba?
Yes.
What are the complications associated with pneumococcal disease? That occurs in 14% of hospitalized adults with invasive disease. Neurologic complications and or learning disabilities can occur in meningitis. Hearing impairment can result from recurrent otitis media. Yung meningitis, an infection of the lining of the brain and spinal cord. Yung otitis media naman, middle ear infection. Tinuturing ng mga doktor na invasive ang mga infeksyong ito. Yung types of infection. Yung meningitis, otitis media, pneumonia. Invasive disease. Yung nabanggit rin kanina. Yung mga mikrobyo na pumapasok sa bahagi ng katawan that are normally free from germs. When this happens, this disease is usually very severe na nangangailangan ng pangangalaga sa isang ospital at maaaring humantong sa pagkamatay in some cases. How is pneumococcal disease treated? Doctors use antibiotics to treat pneumococcal disease such as penicillin or a cephalosporin, which is usually effective. Cephalosporin are bactericidal or kill bacteria and work in similar way to penicillins. Penicillin-resistant strains of pneumococcus are increasingly being reported throughout the United States. In addition, some bacteria such as pneumococcus are now capable of resisting and fighting off antibiotics. Antibiotics resistance is increasingly worldwide because Ang mga gamot na ito ay labis na nagamit o nagamit ng mali. So kapag ikaw ay nasa panganib na magkaroon ng pneumococcal disease, dapat makipag-usap sa healthcare provider tungkol sa kung ano ang maaaring gawin upang maiwasan ito. Next. Is there a vaccine to prevent bacteria? Yes, there are two vaccines used in the United States to prevent pneumococcal disease. Pneumococcal conjugate vaccine or PCV7 for infants and children, and pneumococcal polysaccharide vaccine or PPV23 for adults. The pneumococcal conjugate vaccine or PCV7 contains protection against 7 types of pneumococcal bacteria. Recommended for all children less than 24 months old and between 24 and 59 months old who are at high risk of disease. Ang proteksyon ng bakunang ito ay tumatagal ng hindi bababa sa 3 taon. And the pneumococcal polysaccharide vaccine or PPV23 contains protection from 23 of pneumococcal bacteria. Both vaccines are safe and reduces disease occurrence. All adults who are older than 65 years of age and persons who are 2 years and older and at high risk for disease. Examples: sickle cell disease, HIV infections, or other conditions that weaken the immune system should receive the pneumococcal polysaccharide vaccine. Next. In New York State, pneumococcal conjugate vaccine is required for pre-kindergarten attendance for children born on or after the 1st of January 08. These vaccines protect against many but not all types of pneumococcal bacteria. May pagkakataon pa ring magkaroon ng sakit na pneumococcal pagkatapos ng pagbabakuna. What can be done to prevent the spread of pneumococcal disease? One of the most effective control measures is maintaining the highest possible level of immunization in the community. Ang pagbabakuna ay isa sa mga pinakamabisa paraan na mapoprotektahan mo ang iyong sarili mula sa nakakahawang sakit. Sa pamamagitan ng pagtiyak na ikaw at ang iyong pamilya ay fully vaccinated, hindi mo lamang pinangangalagaan ng iyong sariling pamilya, but also protecting vulnerable people in your community. The more people who are vaccinated, the fewer people will be infected and the less widely a disease can spread. Next topic is tuberculosis. Objectives. A. Who gets tuberculosis? Who is TB? How is TB spread? Latent tuberculosis infection, tuberculosis disease, symptoms of tuberculosis, how soon do some symptoms appear, treatment for tuberculosis, how to prevent the spread of TB, MDR-TB, or multi-drug resistant tuberculosis, and XDR-TB, or extensively drug-resistant tuberculosis. Next slide. What is tuberculosis? Tuberculosis is a bacterial disease usually affecting the lungs or pulmonary TB. Other parts of the body can also be affected, for example, lymph nodes, kidneys, bones, joints, etc., or extrapulmonary TB. Tuberculosis is caused by a bacterium called Mycobacterium tuberculosis. Ito ay maaaring makasira sa baga o sa ibang bahagi ng katawan ng tao at, at maging sanhi ng malubhang sakit. Approximately 1,300 cases are reported each year in New York State. Next, President.
Who gets tuberculosis? Tuberculosis can affect anyone of any age. People with weakened immune system are at increased risk. So, ibig sabihin ay overall siya about 5 to 10% of infected person who do not receive treatment for TB infection will develop the disease at some point in their lives. Sa mga tao naman na may mahinang immune system ay mas risk sila kumpara sa people with normal immune system. Next. How is tuberculosis spread? Tuberculosis is spread through the air when a person with untreated pulmonary TB, cough, or sneeze. Prolonged exposure to person with untreated TB usually is necessary for infection to occur. You may have been exposed sa TB bacteria kung ikaw ay nag-spend ng time near someone with the TB disease. The tuberculosis bacteria are put into air when a person with active tuberculosis disease of the lungs, throat, coughs, sneeze, speak, or sing. At hindi ka mahawaan ng TB sa gamit nila gaya ng clothes, drinking glasses, eating utensil, handshake, toilet, and other surface. Sabi nila nahahawaan, pag may TB daw, yung iba kasi, pag may TB may tuberculosis yung tao, sabi nila mahahawaan ka sa pamamagitan ng gamit nila like clothes, yung mga pagkain, yung mga gamit nila sa utensils, ganun yung gamit nila sa yung ginagamit nila sa eating utensils, mahawaan daw sila. Pero ang totoo ay hindi. Mas mahawaan ka lang sa isang tao na may disease na ganun, pag nag-spend ka ng time na kausap, ganun, pag araw-araw kayo nag-uusap, minuto, segundo, ganun, mas mahawaan ka doon. And when and for how long is a person able to spread tuberculosis? Yung active tuberculosis disease does not develop any symptoms. Person with tuberculosis disease may be able to spread the TB germs until he or she has been on medicine for several weeks. Kailangan pag may TB ka ay kailangan mong take ng gamot, yung dapat yung may connection, hindi yung take ng gamot na wala namang connect sa sakit mo. Madami kasing ganun, porket inuubo sila, yung ubo nila may dugo na, nagtitake pa rin sila ng mga gamot na like, yung Nyosep, ganun yung iniinom nila kasi ayaw nilang magpatingin sa doktor kasi sabi nila gastos lang daw. Kaya mas mabuti na lang na magpatingin tayo sa doktor or sa mas professional para mas sure at saka mas safe yung dinitake nating gamot. Mas maganda kasing advisable ng isang professional kaysa yung advisable ng ating mga marites na kapitbahay dyan na inom ka lang ng mga ganyan, inom ka lang ng ganyan. Hindi maganda yon. Dapat din tayo sa professional. Next, please. Latent tuberculosis infection. Latent tuberculosis infection or LTBI means that a person has the TB germ in their body, usually lungs, but has yet to develop obvious symptoms in latent. TB. The person has a significant reaction to the mantle skin test with no symptoms of tuberculosis and no TB organism found in the sputum. Having latent tuberculosis infection is not enough to spread the germs. So, yung latent naman ay difference between latent infection and tuberculosis. A person with disease ay wala siyang symptoms at may symptoms. That may include a bad cough that lasts 3 weeks or longer. Tuberculosis disease. Tuberculosis disease indicate the person has symptoms, a significant reaction to a mantle skin test and organism found in the sputum. In order to spread the TB germs, a person must have tuberculosis disease. Having latent TB infection is not enough to spread the germ. Tuberculosis may last for lifetime as infection never developing into disease. Yung mga disease kasi na ganyan is pag nagkaganyan ka, may symptoms na mararamdaman ka like yung panghihina ng katawan, pag yung pinagpapawisan ka na lang kahit walang ginagawa, kahit gabi, kahit malamig, pinagpapawisan ka, chest pain, tapos yung dry cough, tsaka yung pag uubo ka is may dugo ng sumasama. Yun. Next. What are the symptoms of tuberculosis? So ito na yung sinabi ko kanina. The symptoms of tuberculosis include a low-grade fever, night sweats, fatigue, weight loss, and persistent cough. Some people may not have obvious symptoms. Yung iba kasi is hindi nila namamalayan na may TB na sila. Kasi pinagwawalang bahala nila yung simpleng ubo. Yung simpleng ubo na yan is pwedeng pumunta dun sa disease na yan. Pag may ubo ka na, dapat yung sabi nila water therapy. Pag may simpleng ubo ka, makukuha pa lang ng water therapy yan. Pero pag yung ubo na may dugo na sumasama at yung dry cough, yung umuubo ka sobrang sakit ng dito sa dibdib mo, yun yung dapat ka nang magpa-check up, magpatingin sa professional. How soon do symptoms appear? Most people infected with the germ that cause TB never develop active. TB does not develop. It can occur 2 to 3 months after infection or years later. The risk of active disease lessens as time passes. Next. What is treatment for tuberculosis? People with latent TB infection should be evaluated for a course of preventive therapy, which usually includes taking anti-tuberculosis medication for several months. People with active TB must complete as a course of treatment for 6 months or more. Initial treatment includes at least 4 anti-TB drugs, and medication may be altered based on laboratory test result. The exact medication plan must be determined by a physician. Directly observed therapy or DOT program are recommended for all TB patients to help them complete their therapy. So, with proper medication and care, hindi yung iinom, yung sinabi ko nga kanina na hindi basta-basta tayo umiinom ng gamot na walang connect sa sakit mo. At saka yung TB bacteria sensitivity is analyzed to determine often a combination therapy is required for several months in cases resistant to drugs, higher order antibiotics, or even intravenous antibiotics will be required. Next. What can be the effect of not being treated for tuberculosis? In addition to spreading the disease to other untreated person may become severely ill or die. Pag hindi kasi na-treat agad yung sakit na tuberculosis na yan, mas dadami yung mahahawaan, maski pamilya mo mahahawaan mo. tsaka yung mga friends, kausap mo ganun, mahahawaan mo sila. So, kailangan, pag may tuberculosis ka, ay dapat, kailangan mong therapy ganun. Basta kailangan mong ano mo lang yung therapy mo, gagaling na gagaling ka rin. What can be done to prevent the spread of tuberculosis? The most important way to stop the spread of tuberculosis is for TB patient to cover the mouth and nose when coughing and to take all the TB medicine exactly as prescribed by the physician. Yung iba kasi, pag umuubo, mas ihaharap nila sa'yo, yung para bang hindi sila magtatakip ng bunganga, ihaharap nila sa'yo talaga kasi kala nila ay magandang joke yon. Hindi nila alam na may masamang idudulot nito, mahawaan sila ng virus. Kailangan din natin, pag mubo tayo, ay magtakip ng bunganga kahit kahit magtakip tayo ng bunganga, pag may kaharap tayo, italikod din natin, tapos doon magtakip na tayo ng bunganga. Tapos yung atching, yung nagbahing tayo, is kailangan din nating takpan yung bunganga at italikod din natin. Tapos pagtapos nun, pag maghahawak ka na isang tao, kailangan din natin mag-spray ng alcohol, di ba? Para mas hygiene din. Hindi yung kahit tapos mo mag-atching, ihawak mo sa kanya, dinahawaan din siya ng virus. Tapos, kailangan din natin ng yung mag-take ng gamot, ganun. Thank you. Next po. Next reporter. Bien.
Audible po ba?
Yes.
Multi-drug-resistant tuberculosis or MDR-TB and extensively drug-resistant tuberculosis. Ano nga ba ang mga ito? Let's find out. Next slide, please. Next slide, please. Multi-drug-resistant tuberculosis. This refers to the ability of some strains of TB to grow and multiply even in the presence of certain drugs which would normally kill them. So, ito po yung mga strain na hindi tinatablan ng mga normal na gamot or standard antibiotics for medication na maaari pong mag-cause ng death ng isang tao kung mapapabayaan. Next slide, please. Next slide po. Who gets MDR-TB? TB patients with drug-sensitive disease may develop drug-resistant tuberculosis if they fail to take anti-tuberculosis medication as prescribed, as well as TB patients to other individuals. Ang mga maaari daw pong makakuha ng klase ng strain ng TB na to ay yung mga tao po na na-immune sa drugs at pati na yung mismong TB ay na-immune na din. And then, what is the treatment for multi-drug resistant tuberculosis? For patients with disease due to drug-resistant organisms, expert consultation from a specialist in treating drug-resistant TB should be obtained. Patients with drug-resistant disease should be treated with drugs to which their organism are susceptible. The effectiveness of treatment for latent infection with MDR-TB is uncertain. So, yung treatment din po pala dito ay hindi po siya or wala po siyang kasiguraduhan na matitreat po kasi nga po yung mga standard antibiotics nga po ay hindi tinatablan Hindi po tinatablan ang klase ng TB na ito. I mean, the strain po mismo. Kasi nga po, yun na nabe-bear niyo po yung lakas ng drugs na dapat pumapatay sa TB strain na to. Next slide, please. What can be done to prevent the spread of MDR-TB? Ensuring people with MDR-TB take all their medication and teaching patients to cover their mouth and nose when coughing and sneezing can reduce the risk of spread of MDR-TB. In addition, directly observed therapy that should be used to ensure patients complete the recommended course therapy. So, para maiwasan po ang pagkalat ng MDR-TB ay tinuturuan na lang po nila ang mga patient na takpan yung bunganga nila pag sila po ay uubo or lalo na po pag may mga kasama sila na family member. Siyempre, kailangan din pong i-observe din yung distant or yung position ng pag-ubo mo. Thank you po. Thank you for listening, guys.
Is that all? Okay.
Ay, I'm sorry po, I'm sorry.
Okay, so
Extensively.
sige, go on.
No sir, I'm sorry po. May isa pa pala.
Sige, go Bien. Okay lang. Continue.
Extensively drug-resistant tuberculosis. Extensively drug-resistant or TB XDR-TB is a subset of MDR15 which strains of TB bacteria are resistant to several best second-line drugs for TB. These strains are very difficult to treat. XDR-TB cases make up approximately 10% of MDR-TB. So compared po sa MDR-TB, mas lalo na naman po tong risky dahil kahit po yung mga best second line drugs are hindi po tumatalab para sa treatment nito. Thank you for listening po. Palagi po sana nating tatandaan na health is wealth. Thank you po.
Okay, thank you so much, Group 4. So this afternoon, we will continue our presentation. Group 5 naman na, kasi nag-message sa akin yung Group 5, accidentally na-delete nung isang member yung kanilang PowerPoint. Okay, so this afternoon natin siya tatapusin.